Jessica. She is a community support analyst with Cobb and Nobis Center. She helps to lead the implementation of the 2023 and 2027 Community Health Improvement Plan, including facilitating COP 2020 and the Douglas Behavioral Work Group. Jessica has worked with Cobb and Nobis Health since 2022 and in public environmental and occupational health since 2014. She is dedicated to the work of creating communities where every person can thrive. Thank you.
I'm really excited to be here today. As Annika said, my role is really to work on community health improvement in our counties in Cobb and in Douglas. And along with that goes kind of the data component. So that's what I'm here for today, is to kind of speak to the data aspect and tell you what we have available, and then talk a little bit about the work group that Annika mentioned, and just the work that's going on in Cobb County, which is pretty phenomenal. So just a note about some of the available data sets. So there are some national data sets that address disability, and they're nationally collected surveys that go on. They do use standard questions, and it's these 6 questions. So are you deaf, or do you have serious difficulty hearing? Are you blind, or do you have serious difficulty seeing, even when wearing glasses? Because of a physical, mental, or emotional condition, do you have serious difficulty concentrating, remembering, or making decisions 5 years or older? Do you have serious difficulty walking or climbing stairs? This is again 5 years or older. Do you have difficulty dressing or bathing? This is for 5 years or older. And then because of a physical, mental, or emotional condition, do you have difficulty doing errands alone, such as visiting a doctor's office or shopping, 15 years or older? So it's great that we have this 6 set of standard questions that's used over and over again. But we still have some differences in the prevalence estimates. So prevalence is just the proportion of a population that has a specific characteristic at a given time. So in this case, disability. But it can vary, even though we're using the same 6 questions, it can vary between those different data sets. And that can be because of the way the data was collected. It can be because of like the response rates to the survey. It can also be just because of the survey itself. So for example, someone responding to a survey that's done by the Bureau of Labor might get kind of different responses than one to like the American Community Survey, which is one we're going to look at. And it's because the survey purpose can prime the person to answer in a different way. So that's why you might see some differences in estimates, and I just want to go ahead and put that out there before we go on. So looking at the American Community Survey, which is one of those national surveys that does use those 6 standard questions, we have an estimate of about 70,000 people in Cobb live with a disability, and that translates to 9.2% of the total population. And this is all age groups. So when we look at by age group, we can see, as we can see going up, we have, under 5-year-old, very low, then 5 to 17, we have a little over 5,000, and it keeps climbing with our highest number of people that have a disability in that 35 to 64-year-old age bracket. And looking at kind of delving into adults, so when you're looking at this prevalence estimate, it's just among people 18 years or older. So 22.1% of people in Cobb County are estimated to live with some disability. And you can see here, it breaks it down by question. So this is from a different survey set. This is called the Behavioral Risk Factors Surveillance System. But it looks at those 6 questions, right? And that's what you're seeing here on the slides. So we have 10.5% with a cognitive disability, 9.2% with a mobility disability, 5.5% with independent living, 5% with a hearing disability, 3.9% with a vision disability, and then 2.5% with a self-care disability. So transitioning into another topic is disability and mental health. So how do these 2 things, coexist or kind of interact? So more adults living with disabilities were found to experience frequent mental distress in a study that was released by CDC in 2020 using 2018 data. So that prevalence, the difference was 4.6 times greater among those that had a disability versus those without. And in this case, frequent mental distress is defined as 14 or more self-reported days where they felt mentally unhealthy in the past 30 days. When we look at Georgia, the difference was 5.4 times. So 34.1% of adults with a disability versus 6.3% among adults with a disability or without a disability. And then we can see NAMI, which is the National Alliance for Mental Illness, just also reports that disability can increase the risk for some mental health conditions. So I want to note here, if you're comfortable, raise of hands. Are you familiar? Is anybody familiar with 988 ever? Okay, that is actually phenomenal. Like we've been working on increasing, as many people, like so many organizations are doing this, right? Of improving awareness about 988. So this is just one of the things we want to cover always in our presentations is, you know, the different reasons that you can call. It's for more than just like a suicide or crisis. It can be you're feeling depressed or anxious. It could be, I just experienced some trauma or I have a loved one that did. It can be thoughts of suicide. It can be like, I feel like I'm drinking too much, or I think one of my loved ones is. And that's, you know, some reasons to call or text. And they do have dedicated services for deaf or hard of hearing.
I have a quick question.
Yeah.
The first percentage you said was 5, I thought. But for it being higher than.
Yeah, so it's like, it's 4.6 times more frequent among adults with disabilities versus adults without, and that's at a national level. And then it was 5.4 times in Georgia. And those percentages, when we look at Georgia, it was 34.1% of adults with disabilities versus 6.3 of adults without.
And that's higher than the national average.
That's a little.
Do you know if that encompasses military personnel? Or if that's removed?
That is a great question.
It's because there's so many military facilities.
Yeah, that's a great question. You know what? I don't want to misspeak. Let me check and see if that survey does cover it. And I can get back to you on that. Yeah. So when we're thinking about general mental health in Cobb County, so this is for everyone, every adult, sorry, it is 18 and over. So we have on average of 5 poor mental health days reported in the past 30 days. And this is again, self-report where they feel mentally unhealthy. And then the percentage of poor mental health or that frequent mental distress where you're reporting it 14 days or more in the past 30 is 13.8%. So just to kind of give an idea of like, you know, this is pretty common in our county. It's something that a lot of people deal with. So then it kind of begs the question of like, okay, we have these statistics about mental health. What are we doing? And it sounds like y'all are already doing it, right? You're familiar with 988. That's a component. Well, we have the community health improvement plan that was mentioned. And one of our goals is improve access to appropriate quality mental and behavioral health services and resources. And this improvement plan was put together with leaders from across our counties, Cobb and Douglas, from different organizations. We got resident input. So it really is meant to be reflective of the needs and the desires of the community. And I think to nobody's surprise, mental and behavioral health came out among one of the top topics, especially as we were coming out of the COVID-19 pandemic at that time. So this is really something that's on people's minds. So our strategies are to reduce upstream risk factors for and increase protective factors against mental illness, substance use, and suicide. So again, thinking of that about pushing down those risk factors and increasing the protection against these things, and then increasing access to and use of crisis intervention approaches and services. So we want that if someone's experiencing a crisis, that they have somebody to call. They have somewhere to go. So that's the 988 component as part of what we're doing is really pushing that information out. Then increase access to quality care for mental health challenges or illness and behavioral health conditions. We want care across the continuum, right? You want, like, hopefully you get care and you don't have a crisis, but if you do, that you have care after the fact. And then supporting long-term recovery from mental and behavioral health illnesses and disorders. So for anybody that is living with a mental health condition or has had one in the past and they're now living in recovery, that we have a supportive environment that really supports that long-term recovery. So then how does this all relate into employment, which is the main topic of this panel? Well, employment's role in mental and behavioral health is that it's a protective factor. It protects against frequent mental distress. It protects against suicide, against substance use, as it helps produce a sense of meaning and belonging. It helps with that access to healthcare, which is really important to getting care. And then it also helps with that economic security and a livable wage. So really, if we're thinking back to those strategies from the last page, that we're decreasing those risk factors and increasing those protective factors. So I'll note too that CDC study that found the adults with disabilities had higher rate of frequent mental distress than adults without disabilities. They found that was lower among adults that were employed, that had a disability and were employed versus those that were unemployed. So again, the correlations was a snapshot in time, but I think that's another piece of evidence in this. And with that, there's a couple of references. You can always contact me. So thank you so much for having me today.
And we will have a Q&A portion at the end, so if you have any additional questions, and we've also got that. So does anyone have any further questions that you'd like to ask them? Okay, I'm now going to come back into the audience and choose someone else to introduce themselves and tell us what their interest is.
So my name is Austin McCall. I think I'm just thinking more so about the disabled community as it relates to what I would call maybe a shrinking economy, as jobs dissipate, as AI takes over more, and as it returns to work policy becomes more implemented. I work in tech, but sometimes we, I hear from a lot of people, people apply, have to answer that question. Do you have disability? Is it a liability at this point? To answer that, due to all of the circumstances surrounding the job market. Some other answers typically around it.
Thank you for sharing that. I think our panel will have a lot to speak on this. I'm excited about that. Okay, so we looked at it a little bit about employment, and next we're going to kind of move into, so as a, all right, let's take off. Very good easy. So as we looked at the kind of employment and statistics aspect of testing that. As a parent, sometimes you have a child and you have a suspicion, but you're not really sure if they have. I'm not, sorry, we didn't have a microphone, but put it away. I'll just project. So sometimes you have a child and you have that suspicion those early years. So we're going to have Yvette come out. She is with Babies Can't Wait. Yvette has been the early intervention coordinator for Cobb and Douglas County Babies Can't Wait for 8 years. She has worked in the early intervention field since 1994. That is a very long time. After early intervention, she plans to oversee the operation of the Babies Can't Wait program at a local lead agency. Yvette is responsible for overall program management for Cobb and Douglas County program. This includes adhering to state, federal, and county guidelines. She oversees staff and contracted therapists in the Babies Can't Wait program and collaborates with external partners to enhance its services. She's married and has 3 children, 8 grandchildren. 3 are they all that? Okay, please welcome. Okay.
So I'm going to talk about things from a different perspective regarding, childhood mental health and parents. I'm going to go over some of the programs that are available to parents and children, both in currently in Cobb and Douglas County, but it also covers the entire state of Georgia in terms of the programs that I'm referring to, as well as even if a family lives out of state, there are early intervention programs out of state, but they may be called something different. And there also are in several different countries. I wouldn't be able to tell you exactly which countries, because we really don't know until a family says, hey, I'm moving to such and such. So then we do our research and find out if there's something there. So for our child health program, both here in Georgia, there are what we call 18 different health districts. Those 18 different health districts are listed up there, and they're broken down into different colors. And Cobb and Douglas County is considered District 3-1. So for us, we have 2 counties that we are responsible for here in Cobb and Douglas. But if you can see from some of the other colors, you have some districts, some health districts that have multiple counties affiliated with them. And so depending on where a family lives, will determine which health district a child or family are referred to. So there's a variety of different ways that you can make a referral to our program. You can use the Children's First screening and referral form, and I have one in the back if anyone would like to pick one up or see what it looks like. But you can also get that maternal and child health Children's First form off of that link, the website that's up there. And the way to do it is you just literally find out where the child lives, you put in the zip code of where the child lives, and then on that far side of the screen, you can see where I have Cobb and Douglas pulled up, and it will list the names of the coordinators and the contacts for you. And there are also on that MCA website, there are a variety of different other programs that you can click on for the different counties and find out other resources there as well. Another way that you can make a referral, anybody can make a referral, is they can call their local Children's First coordinator, and or they can call the Babies Can't Wait coordinator, because we all work together as a family and as a unit, no matter which county you're in. So if we call one and you need to really talk to the other, we all will get you where you need to go. And if you call Cobb and you happen to live in Paulding or Cherokee, then we'll just give you the number for the persons that you need to speak to. So referrals can come from a variety of different places. This is just a short list of the most common places and persons who can make a referral. Parents, pediatricians, other health districts, families do move from out of state. When a family and a child moves from out of state, we have to look at what's going on with the child and figure out what the next steps are. And all of these services, as it relates to mental health, these are the early formative years. And so we start out seeing children, they have a diagnosis, either an established diagnosis for such as cerebral palsy or Down syndrome, or they can have a speech or physical delay. So as we start our early intervention part, which can go, our unit goes up to the age of 21 with the different programs. We're getting children and their parents kind of set for the future and giving them some resources and tips to use, as well as providing them some intervention services. So just to talk briefly about some of the programs that we have here in Cobb and Douglas, but they're also, again, are in all the different health districts. So there are 5 different programs. And again, we serve children from the ages of 0 to 21 in any of those given programs. The newborn screening, every child that is born in a hospital, they have a newborn screening. I believe it's just like a little blood prick. I think it's on the heel, and they test for a variety of different potential diagnoses that could be related to any type of developmental delay. We have our EDDI program. It's also called Early Hearing Detection and Intervention. They initially started off, they just birthed at 3 months, where if a child failed their newborn hearing screening at birth, then they can come to the EDDI program within the first 3 months, get another free screening to make sure they can hear. But they also have recently now been able to go up to the age of 21 and 22 to do more intensive hearing tests, which is great. It helps the Babies Can't Wait program. It helps the entire program. It helps kids when they have to go to school, they can come to the health departments now and get a hearing screening, because sometimes that can be a barrier. Our Children's First program, they go to the age of birth to 5. The early intervention services, also called Babies Can't Wait, we go to the age of 3. And then our medical services, which are called Children's Medical Service or CMS, they go from the ages of 0 to 21. So as it relates to all of our 5 programs, they're still broken down into different types of categories. So we have 3 screening programs, we have an intervention program, and then we have a program for chronic health conditions. So that's kind of how all of the 5 programs are broken down, but we all work together. In Cobb and Douglas, we are very fortunate. We are located on County Services Parkway. It's a few minutes from here, and we literally are all on the same floor in the same suite, and we can just do laps. So if you have a question, or if you have kids that are in multiple programs, you can say, hey, what you think about this kid? Have you been able to get in touch with them? You know, so we're very fortunate. Every district has all of these services. Sometimes they're together and sometimes they're not. So just a couple of statistics. So just a couple of statistics. Our unit here in Cobb Douglas County is also called CYSN, which is Children and Youth with Special Needs, because we're all encompassed together. So for fiscal year 24, we had a total of 2,204 referrals to all those programs I just described. And out of that, 1,219 came to Babies Can't Wait. Fiscal year 25, again, 2,334, 12, a little over 1,200 came to Babies Can't Wait. So with those statistics, about half of the referrals that we're getting for children that have some type of established or suspected developmental delay or confirmed diagnosis are coming to Babies Can't Wait so that we can provide intervention services to them. Currently, we have about 659 children that are actually eligible or potentially eligible for the program. And that number is really, really low. Our numbers have been much higher. And again, the children at this point are in potentially, variety of different ways and eligibility for the program. So really briefly, I've talked already about our newborn screening. Every newborn is tested at birth for given a blood test, and it detects some rare genetic disorders as well as some variety of metabolic conditions. We have our early hearing detection and intervention, also called EDI, because all these things are a mouthful. That's why you got conditions that nobody knows what they are. And again, they can go up to the age of 21 to 22. They screen every newborn again, after they come from the hospital, and they now can conduct the OAE. I am not pronouncing all of that. They do OAE tests and screenings to make sure that children can, fully hear. So Children's First, all referrals have to come through the Children's First program, and it is also part of the Department of Public Health. So Children's First is our initial point in statewide single point of entry. Services that are in Children's First, every child receives a coordinator. They then work with 0 to 5. They do screenings called the Age and Status Questionnaire. They also do an MChat, which is screening for autism. They work with families, they conduct home visits, they provide community resources, and then they also refer children to Babies Can't Wait or CMS if needed. Because again, they go to the age of 5. And those other programs go to the age of 3, but they're more 3 or 21, but they're more defined in terms of what they do. Babies Can't Wait. It's my pumpkin right there. So Babies Can't Wait, because those big eyes just like right there. Babies Can't Wait is also called Part C. So you may have heard Part C, you may have heard Part B, but we're Part C. We're state and federally mandated. We work to make sure that we enhance the development of infants and toddlers. And that helps to reduce developmental delays. It helps to reduce educational costs to the state. We must do a transition plan. Our program stops at 3, so we have to make sure we do a transition plan for the children before they get out. Don't just say, hey, it's nice to know you. We've been, working with you and bye. No, we have to do a transition plan and make sure that they have a plan, families have a plan when they leave. It also is part of IDEA, which is the Individual with Disabilities Education Act. And we're all a part of making sure that we provide early intervention services to minimize the amount of delays. Children and Babies Can't Wait, birth to 3, they live in Georgia, but again, it's everywhere. There's no financial eligibility for our program. The core services, we offer other services, but the core services that families come to us for is OT, PT, speech and special instruction. So occupational therapy, physical, it was too much time. Occupational therapy, physical therapy, speech therapy, and special instruction. Special instruction is like a one-on-one teacher. They all have either a bachelor's or both have a master's degree in education. Every family has a service coordinator. That's their case manager. We do intakes, evaluations, transition planning, all at no charge. families do have to complete a financial application, because if their insurance or Medicaid does not pay or stop paying, then we need to know how those services, the OTPP, speech and special instruction, will be paid for, but again, service coordination is always free. We have what we call category 1 and category 2 diagnoses. Is voluntary except for those families who are privately vaccinated. And I'm going to speed through the rest of this. We do 5 area evaluations to make sure to see where a child is so that we can do a plan. Those 5 area evaluations, we look at cognitive skills, social skills, motor skills, self-help skills, and adaptive skills. So we look at all of those services. Our coordinator manages those, and then we provide those services to the child. Category 1, children who have an established diagnosis. Again, cerebral palsy, Down syndrome, and like 6, 7, 10, 20 pages full of things. Category 2, speech delays, physical delays, or we're not quite sure what's going on. So then we use what we call informed clinical opinion, meaning a child's scores are not significant or moderate, but there's something going on and the team feels like they could benefit from services. So they use informed clinical opinion to provide services. We have a hybrid model currently due to COVID. Prior to COVID, we're all in person. Now we're hybrid, where some services are in person and some are virtual. Our transition is federal law, so we have to do that. Transition can be to home, it can be daycare, or it can be to the special education portion of the school system, which does start at the age of 3. That's one of the biggest places where children go after they leave us, is to the school system. Children's Medical Service, last slides. Again, Children's Medical Service works with children from birth to 21. They provide care coordination and other needed services. They, again, have to live in Georgia, but it's other places as well. You have to have a chronic medical condition in order to meet the CMS criteria, as well as they do have a financial component where the family has to also have a diagnosis, and they have to meet the financial portion of the CMS. But those services are no charge if you qualify for CMS. These are just some of the core services for CMS: coordination. They provide medication. They also provide different types of medical supplies, and they also have to do a transition plan at that point you're becoming an adult. So because they go to the age of 21, so they have to do a long-term transition plan for those young parents and sorry, not the young parents, but the young children and young adults as well. This is how to contact us through all of our different programs. And just want to say thank you. So
Thank you so much. That was awesome. Amazing. Thank you for all the information. I personally did it.
I want to make happy family, taking care of the babies.
Okay, so we've had a conversation about statistics. We've looked at STEM options that's available for children up until they are 21. And now we're going to start with our panel. Please make a good panel. Okay, so first I'm going to also, the contact information for all the panelists are on the screen. So if there's someone that you think, I'm going to reach out to someone to contact, the information is on the screen. Okay, so first we have Candice. Candice Irvin is a therapist, educator, and advocate with experience supporting individuals and families navigating complex care needs. She specializes in trauma-informed care, dialectical behavior therapy, and family system approaches. With a focus on empowering both caregivers and communities, in addition to her clinical work, Candice provides training and consultation for educators and school-based professionals who act as caregiver roles, helping them build resilience, manage compassion, fatigue, and to strengthen the support network. Welcome, Candice. Our next panelist is Ilya Palmito.
Yeah, I'm not.
I like you always right. Is a passionate advocate, educator, and ministry leader dedicated to building inclusive communities for individuals with disabilities. As the executive director of Together We Care, she helps families access essential services while training churches, schools, and organizations to create space of belonging. Jillian has over 2 decades of experience in special education and ministry, and her heart for this work has been shaped by her years as both a teacher and a church leader. I love it. Through her leadership, Together We Care is meeting practical needs while spreading the love and hope of Jesus to families across Georgia and beyond. And I will be contacting you with my church. Welcome, Jillian. Okay, next. Winston Ben Clements. He is a globally recognized motivational speaker, YouTuber, and accessibility content consultant, known for his transformative keynotes on leadership and disability inclusion. With a decade of experience in the tech industry and a background in software engineering, Winston now works with organizations like Google, Disney, EY, Accenture, BAT to build cultures that are truly inclusive for people with disabilities. Born with osteogenesis imperfecta, a rare condition often referred to as brittle bone disease, Winston had defied the odds after experiencing over 200 fractures and being a full-time wheelchair user. His personal journey from navigating childhood surgery to inspiring global audiences has been featured on platforms like BBC, Good Morning America, The Today Show, and Channel 4. He's also done an amazing TED Talk. Welcome, Winston. Monica Oliveira joined Tommy Nobis Center in 2018 as Director of Development. She provided leadership for the organization's annual giving and mentorship campaigns, track and vehicle donation programs, and annual events. She recently played a key role in raising over $5 million for Tommy Nobis Center, new education and training center. With more than 25 years of experience in nonprofit leadership programs and fundraising, Monica has worked with a variety of diverse populations, both in Georgia and Florida. She was previously a senior case manager at Metropolitan Charities in Tampa, Florida, Director of Development at the Housing of North Fulton, Executive Director of Star House Foundation. Her work has earned recognition from the Greater North Fulton Chamber of Commerce, receiving Community Impact Awards in 2016 and 2017, and she earned her bachelor's degree in Human Relations. Welcome, Monica. Sandy K. I love it. My name is Nigerian. Sandy K. Padici currently serves as Deputy Director of Cobb Senior Services. Ms. Padici holds a Bachelor of Arts, Urban Studies from Georgia State University, Master of Arts, Gerontology from the University of West Georgia, and Certificate of Conflict Resolution from Justice Center of Atlanta. Ms. Panici is a member of the American Society of Aging, Georgia Durham. I don't want to take this word.
Gerontology.
Gerontology Society, and graduate of Partners in Policy Making through the Governor's Council of Developmental Disabilities, and original member of the Aging Developmental Disabilities Coalition of Atlanta. Ms. Panici currently serves on the board of Cobb Collaborative. Welcome, Ms. Panici. So this is going to be a conversation. There are a lot of questions on here. We're going to kind of go through the conversations, but feel free to ask each other questions. And if anyone in the audience has questions for them as well, feel free to jump in. Okay, so we just looked at the statistics. We just had a conversation about the challenges that parents experience. What messages, and we also talked about employment. What messages do you wish more people understood? So I'm going to start over here, and we'll just go on. What do you wish more people understood?
Oh, man, no pressure.
That's a really complex question. One of the things that I intentionally left out of my bio is that I am a parent of a 19-year-old who has a disability, and we've moved all the way from Babies Can't Wait And we're starting to get ready to transition, to, looking at employment and what life looks like after school. And so one of the things that I wish more people knew is that, the family is a system. The whole system is disrupted. I don't think that there's a person out there that when they had a child kind of planned for their child to have whatever needs. And I always fight over the last 19 years over the word special needs, because I think that we all have needs that are different from other people. We have individual needs, we have unique needs, right? But none of it is kind of planned for. And so the whole system is disrupted. And oftentimes we tend to think about people in dollars and cents and not in humanity. Right? And so I am a PhD level professional. And when we had our son, my whole system was disrupted. And it's not that people don't want to go out and work, right? But if I have to care for him at home,
That's right.
right? I have to either be at home or pay for somebody to be at home. And so when I think about the whole system being disrupted, I want people to think about, even at my level of competency, if I made $200 an hour, I am making $100 an hour because I have to pay for somebody to be home to do what I do.
Yeah.
Right? And so a lot of times I hear, why don't you go out and work? Why is your resume 2 pages long? Why have you not stayed at this place for so long? Because my life is really directed by my son's needs, and I will always prioritize his needs.
Yeah, that's good. I'm going to piggyback off of what you said in terms of the family unit. What we do at Together We Care is strategic planning for families to help them we start with Children's First and Babies Can't Wait. That's our first referral, getting diagnoses all the way through independent living of the adults, like transitioning, finding supported employment, transportation options, all the things that you have to go through. And all of the systems are so confusing and so difficult to navigate. And so we kind of come alongside families and help coach them through each season of life to help them know what resources are out there, how to navigate those, apply for those. Oftentimes, you can, even if you can figure out how to apply for them, which it often takes a PhD to do that. So, yes, if you can figure it out, then even if you get the approval letter, then families are sitting there going, okay, we're approved, but we don't know what we're approved for or how to use it. And so we have to help them through that. But what we have found is that when you are impacted by disability, the whole family is impacted by disability. So the marriage is impacted by disability. The siblings are impacted. Where you go on vacation, where you go out to eat, where you go to worship, who you engage with in your community, how you volunteer, how you give back to your community, all center around the disability. And that's not necessarily a bad thing. It's just a different way of going that neurotypical able-bodied people aren't used to doing. And so we have to figure out, but the truth of the matter is, of course, with the statistics that we saw, 20 to 25% of the American population has a disability. In Georgia, there are 2 million people living here with a disability. With 2 million people, we have got to figure out a new way of doing society that includes people with disabilities and gives them the opportunities to be able to do what they were created to do and to do whatever their purpose is. And that starts with getting referrals at Babies Can't Wait, right? It starts with understanding all the systems, how all the systems are intended to work together. That Babies Can't Wait funnels into special needs pre-K. Special needs pre-K funnels into special education, adapted sports, adapted arts programs, surrounding individuals in middle school with other mentors who they can get to know, since every middle schooler stops listening to their parents in 6th grade, like all the things. How do we not make mom and dad be the chauffeur when everybody else starts driving and your child isn't? How do we transition out of school? How do we get supported employment? What college programs do we have that are available? All of those things. So I think the central message, I'm rambling, but the central message that I wish people knew is that I guess really the central message that I hope that people will start to get is that we as a society are incomplete without including people with disabilities. That's the bottom line for me. So.
Yeah, I think on a similar theme, I think that from my lived experience when I was growing up, I felt like I was the only one who had a disability. And one thing that I wish that people knew is that disability is not rare. Disability,
That's right.
it's all around us. And I think through my own experiences of maybe always feeling like I was the only one or the one that stood out in all the rooms that I was in, it made me internalize a lot of ableism. And I think I spent a good part of my life trying to deny my disability and to present as normal as I could so that I could fit into all of those spaces, whether that's a educational environment or a workplace later on. And so the message would be that actually disability is not rare. It's in fact the biggest minority group. And it's also the only one that any of us can join and leave at any given time.
Yeah.
And so for me, when we're designing and we're putting in place systems and processes, I think it's important to prioritize that as just part of a human need, not as something that is so important for a minority of people.
Yeah, so good.
I was gonna say, I love what you just said, because I didn't realize that, the dicks in the car, that wasn't originally made for strollers, it was actually made for wheelchair users. But in fact, it's made for wheelchair users, and now you can use it to use your buggy, you can use it for so many different things.
That's right.
Yeah, I love that.
That's great. I can speak similar to Candace. I have a child with a disability as well. I have a 14-year-old that is on the, has high functioning autism. So he has had a developmental delay for quite a while. It's a strange space for my family to be navigating, because not only are we navigating that, but you're also navigating a 14-year-old boy and all the things that come with raising a 14-year-old boy. But what I can say from a workforce perspective and also from a parental perspective is people with disabilities want to work. Yes. They want to contribute. They want their unique capabilities to be recognized. They want them to be utilized, and they want them to be valued. So I know that as a parent and also as a Tommy Nobis Center teammate, what we do is we look at further down into, there's the early years, there's those formative years, but there's also looking at adolescence and looking at the post-secondary road and what that means. So looking at the next chapter, we often find that especially adolescents with disabilities, after they graduate, they don't know what comes next. They don't know what the next chapter is, and they will literally complete high school and then go home and sit and not know what's next. So to me, I would really want the message to be the importance of having those workforce development and work readiness programs in the community, and making sure that families and businesses are educated in that space, and recognizing that, when you look at an inclusive workforce and a diverse workforce, how important that is. There's benefits to them, which I know we'll talk about as well later, but just looking at the family unit and making sure that they have access to those resources and that there's funding within those programs, because especially when you look at the school system, there's not a lot of resources within the schools. They don't have the bandwidth and they don't have the knowledge and the capacity to teach work readiness programming to students with disabilities. So that's a real gap that exists. So that's something that I would really want to make sure that that message is conveyed. Yes.
I also appreciate what you said as well, because I said previous education is a thing where schools are overwhelmed.
They are.
And then it's like, okay, well, you're overwhelmed, but there's a whole population of people that you're missing out.
Absolutely, absolutely, yeah. And when you, and even I'll say, in closing and pass it over to Sandy, I will say, even when you look at the Georgia Department of Education, so across Georgia, there's over 240,000 students that are enrolled in public schools that have a disability. 15,000 of those are in Cobb County. Which is staggering. So it's really important to have those resources to make sure that they transition out appropriately. That's right. Yeah.
Boy, I get to go last. I too have a child with a disability. She has cerebral palsy and developmental delay. And I speak from both that perspective and also probably as an older adult perspective, as my daughter is older. So she's past the teenage years and late 20s, early 30s. So it's very interesting to see as time goes by that trajectory. And for me, it's gaps within different areas within our society. So, without TMI, too much information, starting off, just to give you an idea, it starts with medical professionals. I find pediatrician and pediatrics an area that needs a lot of attention from that early diagnosis. And I use that. What's fascinating to me is you would think that over the years that they would be in the pediatric field, they would be more informed. Just to give you an idea, my daughter was about 5 months old, and I noticed she was startling very intently, and I thought, only child? Oh, she has vertigo. I didn't know. So I didn't think anything of it. I had her in-home daycare with some other children. I went to pick her up one day, and the person who ran the daycare was lovely, and she said, Sandy, and I forget the woman's name, so-and-so has been observing your daughter, and she wanted me to tell you she has cerebral palsy. Oh. I was in a state of shock. Needless to say, as any new mother, I immediately panicked. As any new mother who has a number of physicians in her family, I ran to the good old work manual and looked it up and looked up cerebral palsy. Well, the definition that they gave me defined what I was seeing in my daughter. I naturally panicked even more. Went to the pediatrician, who informed me, she'll develop at different stages. Come back when she's about 10 months old. My response was no. If there's something wrong, I need to know now. I need to face it. I need to address it for her sake. So that took me on a trail to a neurologist where I kind of got the same information, which took me on a trail to a different neurologist who basically started with, I think you should read up about cerebral palsy and I'll see you in another 3 months as to where I got a formal diagnosis. That takes you into other systems, and educational systems. So we have these gaps between our various systems that, in my opinion, we need to pull together and educate each other. When we operate in silos, that is the very worst thing that we can do for individuals with any type of disability, whether it's my daughter's or any other type. We need to close those silos. It's very, very important because we know that life is a trajectory between birth and through all these different stages of development and employment, all of that. So closing these silos is very important. Coming together, making sure that once someone has an individual themselves or their child is diagnosed with any type of disability, they have some type of pathway, because there's so many different types of disabilities that require so many different types of services, intervention. We need to be the pathway to guide people to that. And I think that's what this panel and everyone else who is attending here can come together on and agree on. And it's very, very important that we develop those pathways for the future of individuals with disabilities and really for our society as a whole. I look at the area of disabilities as the last frontier when it comes to issues of discrimination, living in the world of, quote, the other, and what that means in our society, lack of acceptance. It's oftentimes things that either frighten us, we don't understand, we have a tendency in society to either turn our heads or push aside. In our society, we have to put this in the forefront to educate people, to let them know what this means to have a disability. Because as you stated so well, anyone can join this group at any time, any age, any stage in life. And our society and our life is better and more fulfilled when you're including everyone, especially those with disabilities.
You spoke on so many, all of you spoke on so many important pieces. I think, for one, why is it that disabilities gets overlooked? if you go to certain things, categories are shown, but disability category tends to be categorized under mental health, but it's not mental health. It's a whole thing in itself. Like, and then the parents of a child that has a disability, where's the information? Where's the support? There's so much on that. And then if you look at the workplace, like, there's a whole lot around that as well. So that brings me to the next question of what are some of the most common gaps you see in understanding, and what do you think can be done to help bridge those gaps? Anyone can jump in.
I'll go ahead. That's okay. Oh my gosh, there's so many, just like you were talking about, there's so many. But I think that there are so many supports that we have in Georgia. I think one of the problems that we have is that not only are there gaps, but there is so much misinformation out there. And so Facebook groups can be a great place to get information, but make sure that whoever is putting out the information that's a self-proclaimed expert, that you double check it somewhere with somebody who is an actual expert in the system, and going to the system or the people who work within that system to figure it out, if what is the right pathway to get connected with those systems. Because if we look at the whole roadmap of the services and the systems that are in Georgia, they do actually make sense, but the problem is that they are all siloed. None of the systems talk to each other. There is no one-stop shop. That's why we started Together We Care 4 years ago, because I was trying to serve hundreds of families and going, where is the one-stop shop during COVID that we're supposed to send families for caregivers, for special education support, for funding, for when they finish school, when they need supported employment, like I said, all the things, and there are supports for all of those things out there. The problem is that they are in a lot of acronyms, like Yvette talked about. We love in special needs and disability world to talk in acronyms for everything. And so it's in acronyms. So if you're not, I say all the time, just because you received a diagnosis for your child, right, and everything was disrupted, it doesn't mean that you automatically got downloaded all of the files of IDEA laws in special education, or you suddenly become a behavior therapist. Like, you don't know what you're even reading most of the time when you go to these websites or try to fill out applications. And so I think that there is a lot of misinformation, and I think there's a lot of missing information for how we're educating families. And then also, like in the employment space, how we're educating the non-disabled peers and making a way for people with disabilities. Like, they're valuable, and you're missing out whenever you are not including them in your places of employment, in your places of worship, in your in your clubs, in your extracurricular activities. When you're not including them, then you're missing out too, and not only are you missing out on the individual with the disability, but you're missing out on the whole family, right? Because the whole family can't come. And, siblings aren't coming, the parents aren't coming, nobody's coming. And so we're just missing out on a huge piece. So in terms of the gaps, I would really say it's the biggest issue that I see is the silo of all of the systems, and the fact that there's no place to go to bring that together. So we're trying to change that, but we're like a 4-year-old nonprofit trying to reach all 2 million people. We're serving 700 families. Like, it's like such a small percentage of Georgia, but I think we need to begin seeing more one-stop shops that are developed and putting out the right information to families. So.
In 1 hour. If you need to call her, right, please do so now. Thank you.
Yeah.
So from a family's perspective, I will say, it's kind of twofold. I used to do the Nurses Week at Children's Healthcare of Atlanta, and the Providers Week at Children's Healthcare of Atlanta. One of the conversations I became really good at having with them is recognizing when families are just tapped out.
Mm-hmm. Yes.
Right? Like, I am just, you're telling me I didn't make it to this appointment and this, I'm just trying to pay the bill.
Right. Yes.
My husband and I had a fight because he didn't put gas in my car.
Yes.
My 13-year-old decided they don't want to eat Frosted Flakes after I went to Costco and bought all this Frosted Flakes. And so, you know what I mean? Like, I'm just trying to do life. And
Yeah.
then you have added on that I need to see this ology. This is what I
Yes.
call it. My son sees all the ologies,
Yeah.
right? And so now I need to see gastroenterology. And I'm prior military, both my husband and I, and TRICARE just every year goes up in the ante. So they're like, no, now you need to find a pink unicorn and do all of this stuff to get the referral. And so the road is very windy for me to see just you.
Yeah.
For me to get to you, I've had to, it's like Mario, right? Like I've had to get the gold coins and do all of these things. And so, yes, there are gaps, but also we have to understand that people are at capacity.
Yes. Yeah.
Families are at capacity because it's not just you. I have fought with the insurance. I have gone to the school for the IEP meeting.
That's right.
The physical therapist is telling me that I have used all of my physical therapy appointments. And now I need to coordinate with the orthopedist. Like I understand what I should be telling the orthopedic doctor, right?
That's
And
right.
so the person who is the bridge is me.
Yeah.
And I am at capacity.
Yeah. Yeah.
I am done, I am tired, and here I come to the appointment, and you told me I'm 15 minutes late, and Atlanta traffic is exhausting, and for me and my son, we have toileting challenges. A couple years ago, I worked with Children's Healthcare of Atlanta. I said, you serve up to 21, you need to put adult and changing tables in your restroom.
Yes.
We cannot be laying kids on the floor, that's a whole different.
Yes. Yes.
But you know what I mean? Like, we've been in the car for an hour and 20 minutes. I need to find some place to change him. You know what I mean? Like, I'm at capacity.
Yeah.
And there's no one really holding my hand through the process. And then we talk about employment. So one of the programs that I help support at Georgia State University is the IDEAL program, which is an IPSEC program, right? And our IPSEC programs are continuing education programs for our students who have disabilities in Georgia. And I think we have 13, I don't want to lie, I think we have 13 now at different college campuses. And Georgia State's particular program is called the IDEAL program, which is focused on the arts. And what I say to the parents who I primarily support is, when you think about neurotypically developing students, there is this slow letting go that happens. Your child has been to prom. Your child has taken an Uber. Your child has been to the movies with friends. Your child has talked about the world of work. And in K through 12, for children who have some sort of additional program, maybe a 504, a BIP, or an IUP, we're just planning the year out. How do we get them to math? How do we get them to science? The conversation about what they do next should be happening at 16, but there's all of this other stuff that parents are at capacity for that we're not getting fully into the conversation. And hear me out. You know why that might be? Because we don't tell parents your kid can work at 2. At 2, for Halloween, you buy your kid the policeman hat and the fireman hat, and then our kiddos with disabilities, we're just trying to make it through the next year.
Yeah.
We're just trying to make it to PT and OT and gastroenterology and your appointment with New Motion to get your wheelchair fixed. And you know what I mean? All of these things is what we're trying to make it to. And so we don't talk about employment until your kid is about to graduate. One of the things that people don't know in Georgia is when they say your 21st birthday, it means the day before your 21st. It don't mean the semester.
Right, correct.
Right. So if your kid turns 21, January 2nd, the last day in school for them is January 1st. They don't get to finish the semester. So the conversation about employment is happening entirely too late.
Yes.
As a society, it's happening entirely too late because we don't set parents up to think about what are the skill sets that your child has. Let them dream.
That's right.
That's what everybody else is doing.
Yeah, and the issue is that the parents, by the time that parents have reached the middle school years, parents have stopped dreaming.
Yes.
That's the big part.
Yes.
They've lost vision for what their kids are able, and so we need people who will come alongside organizations like the ones that are represented up here to say, I will be, when you're out of breath, I'll come alongside you and I'll be the fresh breath that you need to get back in the fight and to kind of link arms with you and get back in it because you're exhausted by middle school.
Yeah, I want to say one story and then I want to let the rest of the panel. At the program that I work with, we had a student, loved trains, loved Thomas and train, loved trains. And his mom kept saying, I don't know where he's going to work. All he does is talk about trains.
The train place.
Anything about lot of dreams. See, the thing is, right, when we think again about typically developing students, we let them dream.
That's right.
And then for our students who have disabilities or persons with disabilities, we're dream killers.
Yes.
You don't do good at math, well, what are you gonna do? There's so many, I'm not good at math.
Right.
Right? And so just think about the fact that as a society, everybody has the right to dream.
Yeah.
That's
right.
Very much
so good.
And I think that's the problem too, is when you look at the systemic inadequacies,
Yes.
it's troubling. And you never expect to be, as a parent, my story, Sandy, I can completely relate to you. So your story is not, unfortunately, it's not an anomaly. My son was grossly misdiagnosed as ADHD within 10 seconds of a pediatrician walking into an exam room. And because he was restless, oh, that's what he has. And it was awful. And of course, you know, immediately you never imagine that you have to turn into an advocate. And I immediately had to turn into an advocate and, you know, go down all the different channels and, you know, see all the different professionals in the medical field and the psychiatric field and, you know, and figure out, because my motherly instinct told me that that was not the case.
Yeah.
And it wasn't the case.
Then you become this explorer. Also, there's this other piece, and I'm going to kind of pull this little piece in because obviously you see Cobb County Senior Services. So whereas before throughout society, individuals, the lifespan of individuals with different disabilities, unfortunately was shorter. Now with medical advances, all of that, you have a longer lifespan. That's been documented in individuals with Down syndrome, autism, all of that. So all of a sudden you see your world start to kind of come to this intersection whereby you have an older adult parenting an older child with a disability. And so at Cobb County Senior Services, we have care managers. So when the older adult calls and they may have a child with a developmental disability, they can use that information to refer them to services and other things like that. But our society is aging. Also, we need to think of individuals with disabilities in the aging process too. What does it look like for them? And as a society, we have never, just because we grow and we're living longer lifespans, so are individuals with disability. So that area of an individual's life who has a disability, that's still ground that we have yet to explore and yet to address. And then as a side note, as an individuals who have services in the Medicaid waiver. So that's a whole new ground as you're talking about silos and education. We have 7,000 individuals with disabilities on the waiting list in the state of Georgia. So when, you know, people say, oh, the lottery's up to, 200 million or five. No, I think I'd really prefer to have a ticket to have the golden ticket for a Medicaid waiver. So if I have to choose the lottery and if I have to choose between the golden ticket for the Medicaid waiver, I'll take the waiver.
Yeah, I think what I can throw in here maybe is a international perspective, because we moved over here from the United Kingdom about 3 years ago. So I can speak from the perspective of obviously having lived experience with disability and also having a child with a physical delay. And so, we kind of stumbled upon Babies Can't Wait by accident. So we happen to be content creators and we produce these videos that go on YouTube. And just through watching our videos, someone in Georgia wrote us an email to say, hey, you guys should get plugged into Babies Can't Wait.
Wow.
And that's something that we would have never have discovered, because when you move from overseas especially, you've got so many things to figure out. You've got all your systems to set up from scratch, let alone thinking about, where you're going to live and healthcare and insurance. We have universal healthcare in the UK, so it's very, very
So not only did you move to the States, but you moved to the South.
I'm saying.
Right, yeah. popped up for me when a couple of you were speaking is that complexity, and maybe there's an opportunity there for almost like creating a role for like a navigation partner.
Yes.
To help you kind of come through these
Yeah.
complex systems
Yeah.
and kind of be your cheerleader. So it is going to get harder.
Yes.
And in an ideal world, that's what, to me, you need more consortiums, you need
Yes.
more collectives, you
Yes.
need
Yeah.
more of those resources that you can turn to when you need somebody to lean on, when you're
Yeah.
exhausted,
Yeah.
and you need that guidance and that support and that respite that's so critical.
Yeah.
And it needs to be strategic. Like when we started Together We Care, because that's exactly what we do. And when we take on a new family, we create a strategic plan only for what they need right then and there. Because the number of resource fairs I've been to where I have our Together We Care table, and we've got a babies can't wait table, and we've got a guardianship attorney over here, and I have a parent going here and here, and I'm like, time out. Your kid is 8. Please put that back. Please put that back. You don't need that right now. And like, don't put more information in your brain than what you need in this season of life right now. And so we create like a strategic plan for what it is that they need right now, only what they can process, given what all the dynamics of what they're in. Okay, some people can process, like, let me give you a to-do list of 10 things and 10 email addresses and phone numbers and websites that you're going to go to get the services you need. Some people can handle 2 because they're just that stressed out and that overwhelmed. And so knowing how to do that, but then like we have this layer of like resource coaches where after they get that strategic plan, they can meet with us then every 3 months to update the plan, because you have to chunk the information too, because knowing all the systems is too much for one person. So, but we need those partners that are coming alongside us and like learning how to navigate all these resources and becoming resource coaches and volunteering to do that in the community with families.
And it is very important. Also, we must remember there are grandparents who are raising
Yes.
grandchildren
Yes.
who have a disability. So their pathway, we talk about different pathways, different
That's right.
family dynamics and systems. Those grandparents need that information.
That's right.
Very much so.
Yeah.
And because how things are set up in their experience is very different. And all of a sudden they're thrown into a very different experience. So if you think about a parent who, is a little bit younger and their trajectory and their systems, think about the grandparent
That's
who all of
right.
a sudden is in a system that is totally foreign.
That's right.
Just wrapping back to that mental health component, that's why those networking resources and groups are so important.
Yes.
Is because when you're the parent or a caregiver of a child with a disability, it is incredibly isolating.
Yeah.
It's incredibly isolating. So to have those other peers to bounce ideas and resources off of, it's so vital.
It is.
Yeah.
Okay, this has been an amazing. Such a great content, such a great,
To be continued, right?
I want to open it up really quickly to any questions from the audience. If you can also ask anonymously if you like, but you can just scan that QR. It was easy to hold to ask the questions, but if you want to ask the questions out loud, please.
Okay, so kind of wrote my question down, but I want to thank you all. And I just want to say, give my respect to parents that have raised a child with disability. I have one. I have actually osteogenesis imperfecta. I have had over 100 fractures. Spent half of my life in a wheelchair, lots of body casts, 16 8-hour surgeries. My question is, I think a lot of just from the child's perspective, and I'm going to tie it back to that mental health component, where children oftentimes end up as adults with really bad mental health. How can we as a society collectively help to decrease the emotional burden that is placed on the child?
Yeah.
I used to be a teacher. A lot of schools that are underfunded are dark places for children.
Yes, right.
Feel, sense, the disdain, this kid's coming in a wheelchair, kind of something, right? And so, how can we help to decrease that emotional burden toll on children with disabilities that leads to anxiety? They want to disassociate. I wanted to disassociate. That's so much that I refuse to get in a wheelchair. Depression, low self-esteem. I'm particularly focused on what's seeing right in the piece right now, just about children want, naturally, I think it's natural, want to compete. You want to showcase talent.
Yeah.
Children that are able-bodied or physically able to play football and go, and whether you're good or not, your parents understand it. And it's just this feeling great of, oh, I was able to compete, display my talents, my family cheered on. What about those children with disabilities? And one of the things that I found being a public school teacher for the time was that those children are often ignored, and by the time they're in their 20s, they have incredibly poor health. And so some of the things that I'm coming up with now is recommending like chess clubs.
Yes.
That's right. With disabilities needs to be able to display their talents. That's my first question. And then my second question is going to be to Winston. I have a lot of, so that's really that seems a lot. Your wife, when you told her you had OI, how did she react? And the second question is, kids don't know OI, it's cerebral disease, you break a lot of laws, but there's a chance that you can pass it on to child. And I think our society is just not ready, not prepared for those types of conversations. And oftentimes it does interact with people and with their parent. How did that conversation go with you and your wife? And I do follow you both on YouTube. Because OI was not, when I was a kid, oftentimes people assume you got hit by a car instead of, and so, I'm a 90s kid, so we didn't have, we kind of had Google, but it wasn't. So, just think a lot of the YouTube, there's another great couple of you and Antoine on TikTok that are really just taking and said, look, this is who I am, and they're these power couples. So I often rethink, when I think of power couples, I don't think of, unfortunately, I don't think of Taylor Swift.
You think so?
Yeah. I'm gonna ask all the whole questions guys to Winston.
Yeah.
We can, go ahead and keep that.
I've been there, was an librarian.
Okay, so Winston, that's your question, and then we'll go over question.
Okay, I'll start with part two, because that's the one that feels fresh in my mind. And, when my wife and I got together, and my wife's in the back, by the way, I think one of the things that I think really helped us was to have those hard conversations early and to be fully transparent of, what a journey with someone who has OI can look like. So talking about everything from, family acceptance to things that I might need help with in the home, accessibility, caregiving, or, potential risks when having a family, all of those things. And I think having those conversations early on, we were forced to become great communicators, almost by force, right? Because it's not something that you can kind of like, we'll deal with this later on in a few years' time when we're at the point of wanting to have a baby. But the other thing that maybe helped was, or maybe didn't help, but is what we're trying to create through our platform is my wife was able to go and search YouTube, funny enough, and look for other couples who had a similar dynamic to us. So where one had a disability and one was non-disabled, and kind of get a sense and a feel for how that would look like and how that plays out, in year 1 and year 5 and year 10. And so that's what really also inspired us to start creating this type of content, because we realized that, that the people that my wife was looking at didn't even have the same condition as I did. But if we can create that representation so that maybe one day a kid who has OI is able to kind of see themselves in our story, see what that would look like, having their own family, running a business, traveling, getting on airplanes and things like that. I think that's an image I would have loved to take in as a child myself.
That's so good. Yeah, that's good. Sounds so good.
Okay, 2 more questions. Oh, sorry. It was a virtual question.
We had a comment from a virtual participant. The lack of information from the MD offices to the schools to the community partners, DB, HDD, DFAC, SNAP, et cetera, is nearly non-existent.
Yeah.
There's no collaboration for these families, and then they leave the safety and structure of the school system. It's like falling off a cliff.
Correct. That's why I left my job and sold my house and started to get legal.
Yeah.
And a question, who can my son call to get assistance with finding employment? He is on the autism spectrum. He has IT experience.
Right here.
Tommy Nobis.
Right, yes, ma'am, yeah. And GVRA, if they have not signed up for services with GVRA. And that's something important for the employers that are sitting in the room, people who are business owners or work in all of the places who want to hire people with disabilities. You need to understand as an employer what GVRA does, Georgia Vocational Rehabilitation Agency. When families sign up for that, and that's an important reason why Tommy Nobis is one of our great referral partners, is because they do a lot in that space. But the GVRA department is what pays for those services, and they can have a job coach. And so if you are an employer or if you're somebody virtually that has a business, hire people with disabilities. They can come with a job coach that will teach them how to do the job well and kind of scaffold back that support so that they learn how to do the job. There's no liability on the business itself to bring on the job coach. They're covered by insurance. It's, they're paid for. It's no extra money. It's no extra liability on the employers to invite those job coaches inside, into your business with those people with disabilities.
GVRA is a fantastic, they're a longstanding partner with our organization. They're a great resource. We do have the capabilities to serve folks who do not go through GVRA as well. And we are looking at work readiness for students with disabilities as young as 14 and go up there. So definitely we'll be happy to help them.
Thank you.
Yeah, you're welcome.
Contact information for Tommy Nobis Center as well.
Yes.
Yeah, thank you all. So as someone in medicine, I can definitely attest to the shortcomings and disability education. Certainly in medical school education, we really aren't instructed in disability pathology at all. We cover it for a few days, but that's about it. So I certainly do agree that I think a major improvement in healthcare would be patient care navigators. We have that great working wonderfully for our patients. We see, but I guess my question, and it's a big question, but at a systemic level or individual level, what should providers consider, or just improvements? I think better. What improvements could be made for ill patients?
I would love to answer that. So at the graduate level, my certification is a clinical rehab counselor. So I'm a mental health counselor and a clinical rehab. And clinical rehab counselors specialize in working with people post 18, right, to the next stage of life. So we can do anything from state planning, career planning, but also employment. I think about in a lot of the systems that we have in school, where we talk about teachers being overburdened, or in the healthcare system, hiring the right people to do the job. I don't think that a provider, meaning a medical doctor, needs to know everything. I have a teacher that I literally made for my kids. I tell them I'm not Google and I'm not God. I don't know. And then why frogs do the things that you asked me, right? But I say that to say, right, like I think that because you are the point, or the provider is the point that families plug in, there's this expectation that you should be able to answer all of the things. I think tacking on a social worker is great for case management, tacking on a clinical rehab counselor, tacking on the appropriate staffing so that people can get comprehensive care where they already go is the thing. No, I don't think that improving your particular skill set is where, because you're doing so much. I get to see you for 10 minutes. 10 minutes I get to see the provider for. So, I think like that's the answer that I would provide, is just making sure that we're comprehensive when we think about staffing. So we have the right people, because there are people out there that can do that.
Yes, absolutely. I think that is so critical. And that's what I think is lacking in a lot of the medical professional and physician's office is you have your nurses, your physician's assistant, all of that. But where, as you stated, where is your social worker? Where is someone who is a different type of therapist, all of that. So there is someone there. So it's almost like that one-stop shopping. Not quite, but especially because when a physician is faced with giving an individual or a parent of a child a diagnosis, that is very traumatizing. And so to all of a sudden, have the patient or parent walk out of the office standing like this, that they've just been hit with a truck, and they don't know what next steps are, and their own physician is at a loss to give them that. I agree with you wholeheartedly. The physician has enough on their plate, it's how comprehensive is your practice and how are you staffing it?
Yes. And then also too, I think just having literally, if every doctor's office and every school could have a simple packet that goes, these are the state departments, this is what they do, one little paragraph and their website, so that you just have a general knowledge of what are the state departments that support people with disabilities, and being able to just hand a nice neat little 4-page packet. Because we say it all the time when parents call us, like they go to the doctor's office, they just got a diagnosis, they're emotional, they're processing, they're grieving, and then they're like, here's your diagnosis, we'll see you in a year, we'll see you for a checkup. Like, there's zero next steps that are coming from the medical offices or from school. Like they're just, and it's, every system is overwhelmed. But I think having a general knowledge of who is DBHCD, who is GBRA, who is Babies Can't Wait, who is Department of Health, like just knowing who they are for at least a minimal next step for parents is huge,
Right.
It
is.
Okay, last question. I know there's so many, but the panelists and the intro panelists as well will be around. Final question, and hopefully we'll be doing this again. So, yeah.
So, speaking to acknowledgement and speaking to invisible disability is something that I walk in on a daily basis. So, I'm not sure everybody heard, but I'm a bilateral cerebellar stroke survivor, and stroke is the #1 cause for disability, not just in the US, but in the entire world. And so as someone who has gone through having a coma, who walks around with chronic illnesses post-stroke, who is a disabled veteran, I'm grateful that I have resources such as the Wounded Warrior Project here, and as a holistic wellbeing strategist myself, I've been able to curate framework and resources for people like myself, but I want to know, how do we really bring a voice and acknowledgement to those people that are walking around like myself when they see me? Well, are you even disabled? And it's an explanation of, did this really happen to you? And for example, me riding up until I'll never forget, I was going into PT and OT at Piedmont. And this lady reported me because she didn't understand how I was able to park in a handicap, not knowing that I was handicapped. And then a Trader Joe situation. And so I just want to know, how do we give voice and acknowledgement to those people that are walking around on a daily basis with those invisible disabilities? And secondly, just acknowledging that there has to be a comprehensive and a holistic approach to the well-being of people with disability. I think that there is this one thing where, because it's physical, or it assumes to just be physical, that's the only thing that is acknowledged. But how do we start tapping into all of those pieces to know that this is a holistic process and a lifelong journey, not just something that just happens overnight?
One person to answer your question.
Everybody. Everybody. Oh, I have two. Oh, I do have two. Can I get a mom, and then can I get somebody with a disability? Can I get a mom? Yeah. And I say that too because I have a son, he's 7 years old. And I started seeing things early on in this. I'm actually going through this process right now. So this is really encouraging to me to figure out what that looks like, because there's things that he's only child, but it's like, I can see. But there's some things that I have to tap into. My husband, we've had that conversation. So Okay, so I got it. Right. Mom.
Library will close in 30 minutes.
So, okay, yeah, I believe it's less than 30.
5:45. Shut down and all study rooms should be vacated. Not be available after 5:55. If you need to call for a ride, please do so now. Thank you.
So I too identify as having an invisible disability. And I will say that my path has been, my son's disability is much easier to see because he's a wheelchair user. And oftentimes when I'm not traveling with him, I feel kind of, in the beginning, I would feel kind of the same way, even though I have my disabled veterans tag, right? People see you walking and they want to know, well, you don't have disability in the way that I define it, right? Or society define it. And so my path to that has always been, even with my son, to be an advocate. And I know that that can be tiring. A lot of the time to be an educator. There would be times, for example, where they would look at my son because he's making a sound, kids would. And a lot of times families would say something like, oh, no, don't stare. And I'm like, I would prefer that they stare because that, in my mind, I know everybody has their own opinion, that feels like acknowledgement, right? And when you say don't stare at him, it feels like he's supposed to be invisible and something is wrong. And kids are curious. And so even when I have an invisible disability and I see somebody looking at me coming out of my car, because I was just pumping that bass, you know, right? I say to them, right, like disability, if they're open to that, I say disability can look a variety of different ways, right? If you have questions, I find that my path in life is sometimes to open myself to be vulnerable enough to use that as a point of education, because I would much prefer, I know my strength, is what I'm trying to say. And I would much prefer them have that interaction with me than with somebody else who is not having their very best day. Right. And so if that's any solace at all to you, I have decided that my role, if it's with my son who's in a wheelchair and it's a kiddo who is looking at him and they don't understand why, or if they're looking at me coming out of my car and I'm dressed a certain way and they have questions, it's to be the voice for those people who may not be able to speak, who may have just gotten a diagnosis for breast cancer, who may have just lost a family member, and now this person is asking them, well, why are you parked there? So before they have to have that interaction with somebody else, let them have the interaction with me, because I got it. I have a very strong support system, and I'm not saying every day is a great day for me, but most days I feel very privileged and blessed to walk in my shoes. So I decided I'm going to be an advocate and be a voice and use that as a learning opportunity. And because I'm very much less inclined to be offended. Right? Because I recognize that a lot of times people just don't have language around what they're trying to ask. And so I don't correct them. I just repackage it. Why is he talking like that? Well, I just repackage it for them.
So good.
Yeah.
I'm so sorry. We're actually, I apologize. I'm a nice person. But we actually have to wrap up for now. But what I do want to say, before y'all go, thank you.
Yes, thank you so much.
It has absolutely been just a fantastic program to be a part of, on behalf of myself and my department, the library as a whole, and our wonderful patrons. You just did a wonderful service for each of us, and that goes for each and every single one of you. And let me just say, all of y'all are invited back anytime. Thank you. Seriously grateful for that. So thank you.
And you know that woman, yeah. I don't know if it's an email, also contact people.
Thank you.
Sure.
Yes. Nice to meet you.
It's nice meeting all of you.
Yes. So nice to
Yeah,
meet
professional.
Did you put your
Your Insta?